Okay, good seeing you again. In this section, we're going to introduce components associated with the integumentary system. And in doing so, we're going to talk about, and to introduce that topic, we're going to talk about the skin and various membranes that are associated with the skin. We're going to talk about that in section 1, skin and membranes. We're going to talk about classification of body membranes, and then we're going to introduce the cutaneous membrane. In doing so, you'll use this form. If you can print it out, that would be great. We'll have a copy starting Monday when we get back. If you do not have this form or can't print it out, at least become familiar with some of the topics we're going to talk about when I go over the notes. So once again, this will be posted on Google Classroom, the form and the video, and we will cover the introduction to the integumentary system, skin and body membranes. We'll talk about the function of body membranes, classification of body membranes, and to start with the cutaneous membrane. Okay, section 1, skin and body membranes, functions of body membranes. We'll talk a little bit about the functions and what membranes are in general. Note that on your note packet you'll have additional lines to fill out above and beyond what's on this slide, so make sure you follow along, and if you have any questions, let me know. But function of body membranes. We know that membranes, for letter A, are pliable sheet-like structures that act as a barrier or lining or a partition, which is a separation within the body. We know that these membranes also, for part B, line or cover various body surfaces. We know for C that they protect body surfaces, and we also know for D that they lubricate body surfaces. And for the example associated with the clinical correlation at the bottom of this first section, we know that cutaneous membranes, an example of that would be your skin. So what have you learned from some of the clinical applications and correlations that we've worked on in this section that leads you to identify with how the skin accomplishes many of the things that we've covered through B, C, and D in our notes. So write down a few examples of how that membrane accomplishes what we've covered so far. Okay, for our next section dealing with classification of body membranes, we have already kind of talked about the epithelium and the role that that plays within your body. Generally, as we've talked about, deals with coverings, linings, absorption, secretions, things along those lines. So we should have a foundational understanding of what epithelium tissues do, and very similar to the characteristics associated with membranes. But let's classify that membrane into 3 different components. So when we're talking about epithelial membranes, we're talking about cutaneous membranes, we're talking about mucous membranes, and we're talking about serous membrane. Body membranes are also identified with connective tissue, and this is another type of aspect we've already covered. So the next type of classification that we'll actually talk about down the road a little bit involves membranes associated with connective tissues. Okay, let's start with the cutaneous membrane. For letter A, we'll start that out. Cutaneous membrane equals the skin. This is something that you're familiar with. The diagram on this slide identifies with that. So cutaneous membranes, when you think about cutaneous membranes, think about the skin. For number 1, it's generally a drier membrane. There are components that give it unique characteristics, but in general it's a dry membrane, and it's the outermost protective boundary on your body. Okay, superficial epidermis, another characteristic associated with this membrane. And what the superficial epidermis means, it's simple. It's just the outer layer of your body, something we already kind of talked about. But what's unique is number 1, keratinized stratified squamous epithelium. Now this may sound like a lot of information, but if you remember from our tissues and cells component, we talked about keratin and some of the components associated with that protein produced in your body. So to finalize that, the superficial epidermis, that's another example associated with the cutaneous membrane, and remember that is the outer layer of your body. And for number 1, the keratinized stratified squamous epithelium, remember this goes in with number 2, that keratin was an insoluble protein, meaning that it can't be broken down with water or when it's exposed to water. If you remember, this is something that actually strengthens your skin, but it gives it the ability to not be saturated with water. So it's a waterproof system that allows your skin to balance the water that comes into your body as well as the water that leaves your body. And on your note packet, before we get to the underlying dermis, we'll actually start on that when we get back. But what I would like you to do is the bottom section of your first page on your notes, draw for me what stratified squamous cells would look like. After you're done with that, we should have this section wrapped up. Once again, we'll cover it when we get back. If you have any questions, let me know. Have a good day.